Hi, this is Kimberly McPherson, and I'm responding to our Nursing 482 class, Module 2, Discussion 2, Time is Muscle related to a STEMI. In order to understand the importance of that slogan, time is definitely muscle in a cardiac event. One must first understand the complete anatomy of the heart, the pathophysiology of the heart, and also the importance of nutrients to the heart. Looking at the anatomy, we've all have learned in our anatomy and physiology classes and our previous nursing classes, it's a four-chambered, muscle pump, if you will, top two being the atria, the bottom two being the ventricles, with blood first being introduced deoxygenated wise from the right side, going from the atria to the tricuspid valve to the right ventricle into the lungs by the pulmonary artery system from the lungs after it's picked up the oxygen, reoxygenated into the left atria through the mitral valve into the left ventricle to where it's pumped out through the aorta to the different body systems and so forth. Of course, we know that if the heart is weakened, our cardiac output is not great. Anything that has caused damage to the cardiac muscular system, if you will, or wall, can definitely cause a decrease in the cardiac output, thus putting other systems in danger of not having the proper perfusion needed to carry on life. We also know that the heart system is electrical. There is an electrical portion of the heart, which is our natural pacemakers. We have the SA node that is considered your number 1. Your AV node is your number 2. Your bundle of His is number 3. And your Purkinje fibers, which is number 4. And your last ditch effort for your heart to try to produce its own electrical activity. We know if any of those is not working, the one that is the highest, meaning rate-wise, is the one in charge. If your SA kicks out, your AV will pick up. If your AV kicks out, your bundle of His will pick up, and then your Purkinje fibers, I'm sorry, I can't pronounce that word. But anyway, so knowing that, you definitely got to understand that and understand why when a person is presenting with a possibility of a STEMI, ST elevated myocardial infarction, that it's important that we definitely get the blood flow reintroduced to that portion of the heart as quickly as possible. Hence, the slogan, time is muscle. If the muscle wall is weakened in the heart or any portion of the heart is weakened, then it's not going to perform appropriately or as good as it once did. Looking at the anatomy of an MI, that is definitely when some portion of the heart has been occluded through the vascular system. We do have the left-sided of the LCA, the left coronary artery system, and we have the right-sided, which is the right coronary artery system. Of course, the left-sided feeds to a larger portion of the heart, so if we have any kind of blockage or injury to that area, we're looking at a larger portion of the heart being injured as well, which in the long run can cause more injury to the patient and possibly a more poor prognosis than if it were to the right side. So we definitely want to hop on it when a patient presents with the shortness of breath, the chest pain that radiates through the back, down the left side of the arm, jaw pain, tooth pain I've seen in the ER would be indicative of a cardiac event. Definitely got to know the comorbidities of these patients. Your diabetics aren't going to be as dramatic or experience some of the different types of pain or the crushing pain as somebody that doesn't have that comorbidity. It's very important to quickly act when you have these. EKG should be your first thought process when the patient hits the door and complains of chest pain or anything that indicates a cardiac event. Within 3 minutes is goal. We want to definitely look at it, have a quick assessment to see if there is any ST elevation, any of the 12 leads, because that can be indicative to which part of the heart that we're dealing with an ischemia or with an injury. knowing going forward, we definitely want to get an aspirin on board to help with the aggregation of platelets to try to help make sure no other clots can be forming, and then we should also get on board if your hospital doesn't have a cath lab, but go ahead and get transportation in play. Most smaller rural hospitals don't have a cardiac cath lab, so it's very important to have a strong networking with a larger facility that does have a cath lab. We're looking at from door to cath lab time 90 minutes or less. Again, time is muscle. The quicker we can reperfuse the area of the heart that has gone without the appropriate oxygen or clot being and nutrients to that area, the better result that we'll have a recovery of that cardiac muscular usage, and for it to be less damage. The heart muscle becomes weak. It can actually become dead, necrotic in that area, which in later years or later perfusion problems can cause ballooning or aneurysm in that area, where or myopathy or cardiomegaly. All these come into play that causes poor perfusion throughout the body, and the inefficiency of our heart and the pumping of our heart can cause further problems. So it's definitely important to know the appropriate, we want to hyperoxygenate. We place O2 as soon as the patient comes in to make sure that we can get as much oxygen to the cardiac muscles as we can as quickly as we can. We're going to be looking at thrombolytics as far as trying to go ahead and get those clots busted if that patient meets requirements for it. You want to make sure you have 2 large bore IVs established prior to this. We want to make sure we're keeping a continuous monitor on this patient, that we're looking for any arrhythmias and have our crash cart at bedside pretty much in case that portion of the heart becomes more damaged than we think, and we meet an arrhythmia that we would have to start CPR. We should be looking at the causes of this, make sure it's not anything that could be a metabolite causing the injury. We definitely need to do a CMP, your cardiac enzymes, to see where we're at in the process of cardiac injury. Your troponins usually aren't elevated till 3 to 6 hours after the event has occurred. So sometimes your first cardiac profile panel that comes back might not even show indication of injury to the heart. You would definitely want to get a CBC. Sometimes white counts elevated can be an indicator of that as well. So going forward, is definitely time is muscle. It's definitely important for us to understand the electrolyte balance for those cardiac muscles as well. If you don't have a good balance between your potassium and your calcium and your sodium, you can look at, those are all needed for muscles to be able to have the contractibility that they need due to the different systems that you got your sodium potassium pump through your that makes your muscles work, and your potassium and your calcium works as well for your cardiac muscular muscles, myocardium muscles. So it's definitely important to understand that process and make sure establish that there's not no deficits in either one of those electrolytes, because that too can have a factor as far as how well that heart's going to pump and how well that muscle is going to repair. You've got to also look at the byproducts of if that muscle has been without oxygen flow, the necrosis of that muscle is your lactic acid from the muscle being broke down, and also if you have a toxic level of the other electrolytes that we briefly spoke of. So definitely you have a lot going on in the event of a STEMI. You have a lot of things you've got to be thinking and quickly assessing. Definitely establish your monitor, your IV, your O2. You may want to give some kind of medication such as nitro that will help vasodilate and get even more. It helps with the pain, because if you open those vessels to that area as much as you can and get more oxygen and blood flow to there, that's going to help with that cardiac pain. That's the reason why we have nitros and even morphine being prescribed to these patients during this event. Again, look at your low pressure and look at because that's your beta blockers that they want. That helps with the contractibility or the actually output of your heart. It helps with that to make it more efficient. So looking at those things, these are guidelines that the American Heart Association has put out, and going forward it is to help preserve what cardiac function that we can in the area that may be in part of the injury, and definitely getting quick intervention to that area so we can preserve that. So knowing all this information and reviewing all this information, it's definitely adequate to say that time is muscle regarding the STEMI and the appropriate treatment of a STEMI. So remember, IV, O2 monitor, get your morphine on board if needed, your nitros on board, your blood pressures, your aspirin for the anticoagulability and aggravation, so forth with that, and to get your thrombolytics ready to bust those clots up, or hopefully get them to the doors of the cath lab so they can go in and put either a stent or do the appropriate thrombolytics there at the site of the thrombosis or whatever is blocking the blood flow to that area of the heart, so we can preserve that muscle and have a better outcome for our patients. So going forward, I hope this answers all the questions and the requirements that's needed for this discussion. I will be putting my references on the bottom. Thank you. See you next week. Bye.